Hey folks, welcome back to the channel. Today we're diving into a crucial topic, neonatal respiratory care. If you're a healthcare professional working with neonates, this video will provide you with a quick yet comprehensive overview. Let's get started. First up, let's talk about respiratory distress syndrome, or RDS. This is the most common cause of respiratory distress in preterm infants due to a lack of surfactant, which leads to alveolar collapse. Key treatments include surfactant therapy, CPAP, and, if necessary, mechanical ventilation. Remember, antenatal corticosteroids given to mothers can help mature the fetal lungs and reduce the severity of RDS. Next, we have meconium aspiration syndrome, or MAS. This occurs when a baby inhales meconium-stained amniotic fluid either before or during birth. Initial intervention includes intubation and suctioning to clear the airways. Persistent pulmonary hypertension of the newborn, or PPHN, is another critical condition. Inhaled nitric oxide, INO, is the most effective treatment to reduce pulmonary vascular resistance. Now, let's touch on apnea of prematurity. This is characterized by a cessation of breathing for 20 seconds or more, primarily affecting preterm infants. CPAP and methylxanthines like caffeine can stimulate respiratory drive and are commonly used treatments. Bronchopulmonary dysplasia, or BPD, is a complication often arising from prolonged mechanical ventilation and oxygen therapy. Prevention mainly focuses on minimizing the duration of ventilation and exposure to oxygen. Transient tachypnea of the newborn, or TTN, is the most common cause of respiratory distress in full-term neonates. It's caused by delayed absorption of fetal lung fluid and usually resolves within a few days with supportive care. Let's move on to respiratory support methods. Continuous positive airway pressure, or CPAP, is widely used for conditions like RDS and apnea of prematurity. It helps keep the airways open and reduces the need for intubation. Mechanical ventilation is indicated for severe cases of respiratory distress unresponsive to non-invasive support. Key considerations include controlling tidal volume to avoid ventilator-induced lung injury. High-frequency oscillatory ventilation, or HFOV, is another option for severe respiratory failure. It delivers small tidal volumes at high frequencies to minimize lung injury. High-flow nasal cannula, or HFNC, provides better oxygenation and CO2 removal compared to traditional low-flow oxygen. Humidification is crucial to prevent airway drying. Surfactant therapy is essential for improving lung compliance in RDS and should ideally be administered within the first 2 hours of life for intubated infants. Inhaled nitric oxide, or INO, is primarily used for treating PPHN by decreasing pulmonary vascular resistance. Oxygen therapy aims to maintain target saturation levels of 90 to 94% to avoid complications like retinopathy of prematurity from hyperoxia. And finally, don't forget the importance of neonatal resuscitation. A standardized algorithm guides steps like positive pressure ventilation, chest compressions, and the administration of epinephrine if needed. Alright, that's a wrap on our quick guide to neonatal respiratory care. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more updates. Thanks for watching, and see you next time.